Good afternoon, and thanks to everyone for being here on this beautiful Wednesday afternoon. We know that we are facing two ongoing emergencies. One, of course, is the public health crisis brought to us by COVID-19 that we have been here every day to talk about. There is no doubt that that threat continues to be real, it continues to be dangerous, and it continues to be deadly. It is here, and we must continue to face it. But the other ongoing emergency that we have is the obvious economic crisis that is ongoing in this country and certainly in our state, the likes of which we have not seen since the Great Depression. While we have never seen a spike of serious numbers of cases in Mississippi, we have seen economic catastrophe. We have to be willing and able to address both. Our Safer at Home order expires on Monday, June the 1st. At that time, there will be no more business closures. Everyone will be allowed to operate. There will still be health and safety guidelines for people to follow, but we cannot have an endless shutdown. We have to act with courage, trusting our friends and our fellow Mississippians to act responsibly. Here is what our new posture will look like effective 8 a.m. Monday morning. We will replace our Safer at Home order with a Safe Return order. All businesses will be open, but they will have to follow the strict health rules that we have set forward. Every business that we have reopened over the past several weeks has guidelines in place to help them open in a safe, responsible way. If you are part of a vulnerable population, such as those over the age of 65 or those great Mississippians with a pre-existing condition, we will still ask you to stay at home as often as possible. We will have two rules for gatherings: one where social distancing is possible and one where it is not. If you can cluster groups that are frequently in contact together in a socially distant way, you can have indoor gatherings of 50 and outdoor gatherings of up to 100. For example, starting on Monday, if you have a baseball tournament, as long as coaches and spectators stay socially distanced, you could have up to 100 around the ball field. When social distancing is not possible, which, let's be honest, is most of the time, indoor gatherings will be limited to groups of 20, and outdoor gatherings will be limited to groups of no more than 50. Healthcare procedures will be allowed, provided that the hospital reserves at least 25% of their space for COVID-19 patients. That will help us to honor and achieve our original goal, to prevent our healthcare system from becoming overwhelmed. Schools may open their buildings for summer programs to make up for time lost during distance learning. Local governments may be more strict, but we believe that this is the best path forward for our state given our current circumstances. That order will stay in effect from June 1 through June the 15th, when we will reevaluate again. I want everyone watching to please listen closely. This does not mean the threat is gone. COVID-19 is a deadly enemy that is still in our midst. We live in a dangerous time, and it is up to all of us to protect ourselves and to protect our loved ones. There are no perfect options, but freedom with risk is better than a prolonged shutdown that threatens livelihoods and lives through government action. I trust you. I trust the people of Mississippi. I know that you want to do right. When we asked the people of this country to shut down, we did so with a tangible goal: to slow the spread of the virus so that we do not lose control, so that our hospital system does not get swallowed up, so that anyone who could get better with quality care gets that quality care. We, working together, are accomplishing that goal, and we need to honor our commitment to the people who have made sacrifices. We understand the threat is not gone, but we are slowing the spread. People don't even like to use the term slowing the spread anymore because in many places in this country, the goalposts have shifted. But in Mississippi, we have flattened the curve, and we've got to respect and honor the people of our state and know that they will continue to make good decisions. If you were to look, as I do every single day, at the graph of hospitalizations, at the graph of ICU usage, at the graph of the number of patients currently on ventilators, it is practically a straight line. That cannot be swung by an increase or a decrease in testing. It is our most important measurement, and it is flat. We need to protect the integrity of our institutions by acting cautiously without extending this unprecedented control beyond what is justified. I do want my fellow Mississippians to understand, if we have a resurgence, that any future tightening of the reins is carefully considered. I can only do that if we also lessen restrictions when we can. We had our first COVID-19 case in March. Approximately 3 months later, it is a time to allow everyone to return to work, understanding that their actions are the difference between life, health, disease, and death for themselves and their neighbors. That is called personal responsibility and is the backbone of our system of government. To my fellow Mississippians, please be careful, be cautious, use common sense, stay safe, take care of yourselves, take care of your neighbors, and working together, we will come out of this. Dr. Dobbs, if you would, I'm going to turn it over to you to give an update.
Thank you very much, Governor. New cases reported 313 new cases today. Unfortunately, 18 additional deaths. We do have some ongoing concerns about localized outbreaks and transmission. Yesterday, we talked a little bit about some cases around a funeral, and that funeral, just for some descriptives, it happened in Northeast Mississippi. And just a little bit about kind of what happened. It's really a good narrative to let us understand what the risks we're talking about. So it was a funeral. There was a event that was indoors, that was not at a church. There were over 50 people indoors. And within that group, there was one symptomatic person and 13 cases and 8 suspects. Looking at one individual case and now 21 new cases. These are the scenarios that we're terrified of. This is the same kind of stuff we saw at the beginning of the outbreak, and it's so important for us to honor these social distancing rules because they work. They really work. So please honor the rules consistent with the order that the governor has executed. Please maintain the 6 feet social distance and wear your mask when you're around other people because there are real world implications to this. The other thing that I want to talk about is trends in different counties. And if we look at what's happening, we had almost 3 weeks ago, we did have the announcement about the 7 counties that were going to have sort of enhanced restrictions as far as like social distancing and masks and all that. I'm happy to report that all of the counties have had decreased rates of transmission, and especially if we look at a metric called the doubling time. So how long it takes to go from 2 to 4, 4 to 8, 8 to 16, so a doubling time. Within some of the counties, in Scott County, that doubling time from the 11th of May increased from 29 to 77 days for doubling time. So it takes now, based on the transmission, it would take 77 days to double the number of cases in Scott County. In Leake County, that number went from 20 to 62. In Attala, that number went from 17 to 60, and in Newton from 16 to 35. So I would like to just give my thanks to those communities for your diligence and complying with the order and having the community spirit to do those things that are going to prevent transmission to others, protect your neighbors, and protect your family. I would like to also give a little bit of an update on Wayne County. We are investigating Wayne County very closely. We have seen a remarkable increase over the past couple of weeks. And, you know, I told you that doubling time for, say, Newton County was 16 days on the 11th of May. The doubling time calculated now in Wayne County is 4 days. So there is some rapid transmission going on there. If you live in Wayne County, I beg of you, please practice social distancing, wear a mask in public, and please, please, please do not go to mass gatherings because there is a high degree of transmission apparent right now in Wayne County, and we'll have more details for you guys in the future. That's what I have, Governor. Thank you.
Thank you, Dr. Dobbs. We have Director Michelle, who's going to give us an update from the emergency management team's perspective.
Thank you, Governor. Just real quickly, I'll run through PP update very quickly today. Deliveries for our Tier 1 facilities located in East Central Mississippi are ongoing today. Just want to take this opportunity to thank again the great men and women working with the National Guard. They've logged over 100,000 hours, 100,000 miles, excuse me, during the last couple of months getting this PPE out to our Tier 1 facilities. So thanks very much for that Herculean effort. Great job by those men and women. FedDeck update, nothing major significant to report from yesterday's report. I do want to remind everyone, though, of those that are in the affected counties for the individual assistance declaration for the Easter tornado that occurred on 12 April. Just want to remind everyone that June the 15th will be your deadline to file your application for individual assistance under that declaration. Again, June the 15th, and you can do that online. If you need any information about that, you can go to my website at www.msema.org for more details. Had a great call this morning with the county EMA directors. I just want to spend a little time right now talking about hurricane preparedness. As we've talked every day about the COVID pandemic and the challenges that we face and the challenges that we'll be facing going into hurricane season. I cannot emphasize enough that sheltering operations continues to be the biggest challenge and the biggest point of concern, a point of contention for the emergency management directors in the lower coastal counties. So for many of you that are listening to this press conference today, many of you won't be affected, won't find yourselves needing to seek refuge in a shelter. For those of you, though, that live on the lower coastal counties or work in the lower coastal counties, I just want to reiterate this. Based on CDC's guidance, the number of shelters that will be required to maintain that will increase. That means an increased workload, manpower, and resources available. And in some cases, some of those counties will not be able to provide the total number of shelters that are available. It does not mean that you won't have access to a shelter. It just means that you may find yourself in a situation in a shelter where social distancing cannot be maintained. So with that being the case, I want to remind everyone, we want you to evacuate early if your area comes under evacuation notice as we go into hurricane season. Why are we talking so much about hurricane preparedness now? Because it's not even the beginning of hurricane season yet, and we've already had 2 tropical storms already this year. So we can anticipate an earlier activity this year. Plan now. Plan where you're going to go. Plan to evacuate when asked to do so. Know where your evacuation zone is. Every one of the areas down in the lower coastal counties are identified by Category 1, 2, 3, and Category 4, 5 storms in your evacuation zone. Please evacuate when you can. Your vehicles, making sure that you've got plenty of fuel, make sure that you're checking your 3 to 5 day supply of emergency supplies, and finally make sure that you add PPE to that kit. We'll continue to be talking about hurricane preparedness messaging as we go while we operate in this COVID environment. Governor, that concludes my update today, sir.
Thank you, Director Michelle. I just want to reiterate what Dr. Dobbs said. When we put in additional restrictions and guidelines in those 7 counties, we did so with the intention of slowing the spread in those 7 counties. Now we are talking about additional counties such as Wayne County, and that really gives you a pretty good idea of what our mentality is in dealing with this virus. We're going to be very surgical in nature. These 4 counties that have seen significant improvement, that's very positive. Perhaps at some point we will reduce the restrictions in those counties, but that doesn't mean that we're not going to add additional counties as these proposed or possible outbreaks continue in other parts of our state. It's critically important that we continue to focus on it. We know that the virus is still here. It is still spreading. Our hospital system is not being stressed overall, but we have to monitor it not only from an overall standpoint, but also in each region of the state, and we will continue to do that. And so I know that we do have an interesting event in American history happening later today with the launch, I understand, and so we all probably want to be able to get done with this soon and early so that we can certainly watch that, but we will take any questions that you may have at this time. Courtney Ann.
Can you talk about those numbers, both for the indoor and outdoor, if you're able to social distance and if you're able not to, and how those numbers were arrived upon, especially considering that description of what happened at that funeral? Somebody may say, well, why is 20 or 50 or these magic numbers, or help them understand why those numbers?
Well, let me say this about funerals, in specifically funerals and weddings. Those are two types of events that, while even if you have the space to socially distance, they don't exactly lend themselves to social distancing, because typically when you have a funeral, you have the family that stands at the front that meets and greets every visitor that comes to pay respects to the fallen. And it's just natural that we in Mississippi, when we do that, we offer hugs and we hold those hugs for long periods of time, and it's really hard to social distance during the middle of a hug. And so when that happens and you've got, let's just say, 8 or 10 family members, one of those family members is contagious with the virus, and even if it's 45 people who come through, there's a very high likelihood that there's going to be transmission. Said, if you look at something different in a large space, if you were to have, for instance, 50 people, of which were all sitting around tables, and there were 4 per table spread out 6 feet apart, well, you can envision the differences between that and others. And so, and when you talk about outdoor gatherings, clearly the transmission is less likely to occur in outdoor areas, and that for that reason is the reason that we have allowed for up to 100. Again, think about a fairly large baseball park, baseball field. You could line all the way around the field, fairly easily get 70, 80, 90 people, 70 fans, if you would, lined up around the fences without people becoming closer than 6 feet apart. Again, these are guidelines. These are what we are suggesting. This is how we believe we can reopen, return people's lives as close to normal as possible, while at the same time recognizing that there are continued risk, there are increased risk if you do certain things. But we think this is one way going into the summer that we can try to thread the needle, which is how do we get businesses reopened, how do we get kids' lives back to as close to normal as possible after literally 3 months of fighting COVID-19, while at the same time doing it in such a way that we can mitigate the risk. We are not going to eliminate the risk of spreading the virus. Our hope is that we mitigate the risk so that if and when new cases occur, and they're going to, that we, again, continue to maintain the integrity of our healthcare system. Yes, sir.
Dr. Dobbs, the judge has ruled that the Department of Health has to release the names of those long-term care facilities in the interest of public interest. When are you going to release those names?
So we have had a ruling, and we will absolutely comply with the elements of that ruling. And when we get those requests, we will do them as we're supposed to and respond within 7 days and get a response. So we are doing that right now.
So you're going to release them based on the request? You're not going to just put out the list?
We're going to review, like the procedure is supposed to be done through our legal division, and our legal team is looking at the requests that have been sent in right now.
Renee? I'm sorry. 1 second. Yes, sir.
The $2,000 in direct payments to barbershop and hair salon owners, what is the process for getting that money to those folks, and how soon will that money be going out?
Well, the Department of Revenue, as required by the statute that passed the Mississippi legislature and became law, is working with the Mississippi Department of Finance Administration. It is my hope that those checks go out as soon as is humanly possible. That is a program, for instance, that I was very supportive of weeks and weeks and weeks ago, and so I am hopeful that those checks can go out as early as next week.
And how will that, so every barbershop owner, every salon owner automatically will receive a direct payment of $2,000 if they qualify?
Well, and that's the key, is that we have to ensure that we have a process in place whereby everyone that receives a check actually qualifies not only under the state statute, but also qualifies under the Department of Treasury Regulations. Because remember, these are federal dollars that were appropriated by the U.S. Congress to the states for specific purposes, and so we've got to comply both with the guidelines of Treasury. Otherwise, Treasury will have the ability to come back and roll those dollars back and force the state government to repay it. Those individuals who receive it probably will never be bothered by the Inspector General of the United States Treasury. It will be the states, because that is who they gave the money to. And so we got to make sure that everyone that gets the dollars receive it in a way that is compliant with both the state statute as well as Treasury regulations, and we're committed to a process that ensures that. So,
Dave Elliott from WLX has a question.
Okay, thank you. Governor, I think it's safe to say 50% of the population is anxious to restart and reopen. But then there's the other half that might be saying this is too much too soon. You talk about the importance of common sense. Human nature tells us that will be tested. So what do you say to cities, counties about enforcing social distancing rules and gathering guidelines? What can they do if businesses and citizens are violating safety measures? What advice do you have for local government?
well, the good news is we have some very capable, competent local government officials in our state. I have done weekly and sometimes 2 and 3 times a week conference calls with mayors, with supervisors over the last several months. And I think generally speaking, we are on the same page as it relates to this. Certainly, as is the case with every law that is law of the land in our state, we depend upon our local law enforcement officials to enforce it. We also have state assets and state resources that can fill in the gaps if and when those local law enforcement officers ask for it. We certainly don't want to tread on their territory, but we certainly have ability to be helpful should that be the case. But it is critically important that the people of our state understand that the threat is real, the threat is not over, and it is very important that we as a people exercise diligence, make good decisions, protect ourselves. Personal responsibility matters. It has mattered throughout this, and it's going to matter in the future. Bobby?
Governor, the House just voted, and you may know this, you may not know it, just voted to extend the session essentially through the rest of the year, through the calendar year. Do you have any thoughts on that?
I did know that they were taking that up. That's the prerogative of the legislature, and if they're going to work, my understanding is that it was said on the floor that this wasn't going to cost taxpayers any more money, and so if they're going to work for free, then I think that's good.
UMC announced that they're laying off people making some financial decisions. Two-part question. What's your reaction to that? It seems to be about 250 employees. And secondly, does the CARES Act in any way can help them not lay off those employees?
Yeah, so that's a two-part question. The first part, I would say I'm terribly upset that this is occurring. It's no one's fault. The fact of the matter is, with COVID-19, and this is true of UMC, but it's true of many of our hospitals, the voluntary and elective surgeries, even though we have allowed them to reopen, are still way down. People are getting less. They're utilizing the healthcare system less. That leads to revenue losses that were unexpected and unanticipated, which ultimately leads to terribly unfortunate layoffs. Within the CARES Act, I believe that the hospitals of Mississippi have received, I don't know the exact number, but I believe it's $430 million from direct CARES Act funding that was in the bill. As you'll recall, in the initial CARES Act, $150 billion was dedicated to state and local governments, and $130 billion was in the bill directly for hospitals around the country. And again, that money went straight from HHS directly to the hospitals, and so it didn't come to us. But my understanding is the total amount that UMMC received of that $430 million was somewhere in the neighborhood of $25 million, I believe, which obviously is a far cry from their $1.4 billion budget.
Nick Judy from Jackson Free Press has a question. Nick?
Yes, this is a question for Dr. Dobbs. Have you received any pressure from the nursing home industry not to reveal the names of LTCs affected by COVID-19?
I have not. They have not. I have not spoken with any of them directly. No, sir.
Kobe Vance with MPB has a question. Kobe?
Yes, this is for Dr. Dobbs. As masks become more politicized, and even some of the nation's leaders have gone to hospitals and manufacturing plants without them, what is the meaning behind the mask again? Just to reiterate how important it is to wear a mask in public when you're going out.
Yeah, thank you for asking that question. If we do the simple things, we'll be in such a better position than if we are stubborn for no good reason. The mask has several roles. A cloth mask can block up to 90% of infectious particles when people are contagious. And we know that the majority of people who are contagious don't have symptoms. So the only way you can prevent transmission if people are getting together is to stay away from folks and to wear a mask to prevent contamination of the air and the surfaces. It also keeps people from breathing in infectious particles, and it keeps you from touching your face. It's such an easy thing. This little guy right here, I really like it because it's breathable. There's different ones you can get. So get one that's comfortable. I know sometimes you can get them really thick and you want to protect yourself, but if you can't breathe through it at all and you're not going to use it, don't get it. So encourage people to get a mask, get one you're going to use a bandana, use any sort of cloth face covering. It's just such a simple and easy thing to do that it's going to keep us out of some of these messes that we're going to have. And I don't know that that's one of the main reasons why we've seen such improvements in Atala and leak and those sort of areas, but it's a part of it. And it's just a simple, easy thing to do.
And as a reminder, 2.25 million community masks have been delivered to the 82 counties throughout Mississippi over the last several weeks. That's a Herculean task, and one that I give great credit to the Emergency Management Agency, to MEMA, to our Mississippi National Guard, who were very instrumental in getting that distributed. And so if you are in a community, do not have a mask and need a mask, there is a way in which to get one for you. So, Renee?
Taylor Vance with Daily Journal has a question.
Yes, I have a question for Dr. Dobbs. I was wondering if you could provide a little more information on the event that you referenced earlier where one symptomatic person likely infected or led to 21 new COVID-19 cases. Could you say what county this was in? If all of the 21 people are confined to one county or if they're spread throughout different parts of the state? Has this led to an outbreak? And how the health department is sort of tracking this one incident?
Yeah, so just for anonymity and privacy, we're Northeast Mississippi is much description on geography as we'll share. There were not only people from throughout the area, but people from out of state who came in. So this is the kind of thing we're talking about. We can't let our guard down. There's still coronavirus out there. There are safe ways of doing things and unsafe ways of doing things. This is not surprising. We've seen so if we're talking about how are we going to let this thing peter out, we got to get it to an R value of less than 1, right? So the average person infects less than one person. And if we have a few of these 21 infected sort of scenarios, and it might be more than that, there's no way we can get less than that R value, that R naught value of 1. It's very important.
Well, and I would just point out that, this particular scenario that Dr. Dobbs has described is exactly illustrative of the contact tracing that we are now doing. To be able to pinpoint the one person that was contagious at this event, and because we have the contact tracing teams in place to then go identify the 21 people currently that they have identified that received. That doesn't mean that this particular individual infected 21 people. It's that we have identified 21 people already. That doesn't mean that you go to the next level that we will not find more. But the point is, we just got to be smart. We got to understand that many of these gatherings are they're dangerous. We're in the business of trying to mitigate risk, understanding that we've got to get back to some sense of normalcy. And so what we're asking Mississippians to do is don't go to events or do events that by definition are going to increase risk rather than mitigate risk. We've got to all be in this together and focus on doing that.
Governor, I'm going to pass along a question from one of our other team members so I don't mess it up. You mentioned yesterday that Mississippi's new cases have been relatively flat for 60 days, even saying that you see that it fluctuates a bit over a 7-day period, but that 7-day average doesn't show something relatively flat. It shows more of a plateau that you also mentioned. Today, though, is the highest 7-day average that we've had since this started, meaning that it wouldn't be flattening. So why does the Department of Health data seem to contradict what you said yesterday?
Right. Well, what I would tell you is I think a 45 to 60-day plateau and a graph that is flat is saying the same thing. A plateau, by definition, is relatively flat. And just to give you an example, at the peak, one of our neighboring states to the west had several thousand new cases per day. And they have, since that peak, which was 30 days or so ago, have been coming down. But even in a state with 1.5 times our population, they still had 490 new cases yesterday. If you look at our 7-day average over the last 45 to 60 days, it has been somewhere between 200 and 300 total cases. As we continue to ramp up testing, and particularly as we ramp up testing amongst people who are asymptomatic, it is not at all surprising to us that we are finding new cases. We would not have found asymptomatic cases 45 days ago because we weren't letting people who were asymptomatic get tested 45 days ago. We had constraints on the total number of tests that we could do that are less so today. And so I think when you look back over the last 45, 60 days and you look at total number of new cases and you look at the fact that we're between 200 and 300 new cases on a 7-day rolling average for literally weeks and weeks and weeks on end. If you look at the total number of hospitalizations, you look at the total number of ICU patients, you look at the total number of ventilators in use for COVID-19 patients, every one of them are almost a flat, straight line. And so I think that that's where we find ourselves today. And hopefully we will not see any more increases in the total number of cases. But if we continue to test more and we continue to test the population at large, it will not surprise me if we find more asymptomatic cases. I think one of the things, and I don't know the answer to this, I don't know that we know exactly how contagious asymptomatic people are. They're clearly contagious, but are they as contagious, say, as someone who's got 103 fever? I don't know that we know for sure exactly what the answer to that is, but it's still important that we find these asymptomatic cases, particularly around nursing homes, because if we can find and identify asymptomatic cases, particularly those workers that are coming in and out of the facility, well, then we can isolate and quarantine those individuals, and it mitigates risk for those individuals that are in the nursing home. And we have found, particularly in the last 30 days, it is those in the nursing homes that are most at risk because they tend to be older, they tend to have other pre-existing conditions as well.
Craig Ford with WTBA has a question. Craig?
Renee, thank you. I'm guessing this is be for Dr. Dobbs. Trying to get some clarity about a couple of reports we've gotten out of Aberdeen and Monroe County. It initially started with word coming that, I need you to clarify this for me, that the word was the state had shut down 3 businesses because of COVID exposure. What we do know, in talking to a couple of restaurants, they're saying they have shut down temporarily. We know there's at least one retail business that is closed. And I don't know if this is part of contact tracing. I don't know if you could also sort of go into how that process works, but what clarity or what can you share about what I just shared with you?
Yeah, certainly. We have not closed any businesses, so that has not been an active sort of event that we've done, and certainly would never do so without discussing with the governor. Now sometimes restaurants will get closed because they violate rules, and that's a different thing, right? Like if they have sanitation issues, and so that might be something that I can check into, and that's pretty routine. But what plausibly can happen is if there are enough employees that are isolated or quarantined, it might be hard to run a business. And certainly I can acknowledge that. And even in the long-term care setting, we have had some strains when they've had a lot of folks out because they're contagious. But obviously you can't have contagious individuals, working with the public or in the public, promulgating additional disease. But, there have not been any COVID related closures because of an outbreak from the Department of Health.
Ross. Under your new order, I didn't hear you mention any state agencies. Are you guys going to set an example and reopen state agencies? And how soon will tours be resume at the governor's mansion?
Yeah. So the new order does not address state agencies. We addressed state agencies last week. We ordered state agencies to begin the process of developing a plan to reopen, and we have certainly done that in all the agencies that work for us. We don't have those plans completely in place. But you've got some agencies like the Department of Finance Administration that probably has somewhere between 60 and 70% of their workforce back, and then some roughly half of the additional workers are working from home and continue to work from home. And what I think you'll see in those agencies where we have good, strong, responsible employees that can complete their task by working from home, we'll continue to allow them to do so. You've got a lot of state agencies like the Department of Health and MEMA, for instance, that never shut down, never sent hardly anyone home because some of us just didn't have that opportunity to do so. So the order does not deal with that. The order does deal with museums, and it allows museums to reopen on June the 1st. I don't anticipate that the Department of Archives and History is going to immediately open all of their museums in a really quick manner, and I think that's perfectly understandable and perfectly acceptable. But it does allow for museums and other what we would call indoor entertainment venues to reopen on Monday.
But it seems like you're allowing the public sector to go slower than the private sector. Why is that?
We are allowing the public sector to go slower than the private sector. There's a couple of reasons for that. The primary reason is that the decision was made months and months ago that public sector employees are getting paid, and they are allowed to get paid by the taxpayers under the orders and under the legislation that was passed before the legislature went out, both at the state and the local level. And so many of these private sector employees were not getting paid, and to the extent that they were getting paid unemployment insurance benefits that in many instances did not meet what they could make in the private sector. And so I see it as two totally different things. We are getting the public sector back open as quickly as possible. We're trying to do it in a safe, responsible way, but we also understand that those employees are being compensated to the full extent, at least at the state level. So they're getting their weekly and monthly paychecks. Bobby.
Governor, going back to masks, you were on the Senate floor yesterday talking to senators and the Lieutenant Governor's husband without a mask. Is that, you might have had a good excuse, but does that kind of contradict what you've been, and Dr. Dobbs has been saying up here for weeks?
Yeah, what I would tell you is that that when I have gone out in public, which has been fairly rare the last 3 months, I have been trying to wear a mask. Ely has worn a mask to the grocery store and to Target and some of the places that we have to go to maintain our ability to live. And I probably should have had on a mask yesterday afternoon. It's not mandated. It's not as if it's a mandate, but it's certainly more responsible. And those of us in the public sector and in government, we have to take sometimes some risk, but no doubt I usually have a mask with me and probably should have had it on the floor. Yes, ma'am.
Has there been any thought about putting out recovery numbers by county? We've had some people wondering that, trying to figure out, especially in some of these counties that early on had a lot of cases, if things are looking much better in those counties.
It's certainly something that we can do. In all honesty, though, when we have these sort of micro requests, we only have a limited number of staff, and they're staying up to like 11 o'clock at midnight to get this stuff finalized. So we can add things that are prioritized, and certainly if there's a reason to do it, we can do it. But we can look at trying to build that out. So, but as we build staff, I think we can do more and more personalized requests.
Erica Hensley with Mississippi Today has a question. Erica?
Thanks, Renee. A question for Dr. Dobbs, sort of following on what Craig asked a minute ago. I've had this question from both doctors and patients. Can you generally give us an idea of where people are contracting the virus? I know, there's a ton of options between work, home, businesses now being open, but what kind of trends you're seeing from contact tracing? I know long-term care is driving deaths right now, but not necessarily new cases. So what, other than the funeral example and some industry you've mentioned, are driving the trends through contact tracing?
Yeah, so we do, when we look at it, we break it down into community transmission and to outbreak-related transmission. And for an outbreak, when we interview folks, we can find like a common thread, like they're at a church or a nursing home or maybe a business. And so it varies county by county. So as an outbreak, like in a business, that's pretty obvious, right? In the community, we do believe that the people who are getting it a couple of ways. One of the most significant ways of getting is it from family. Within a household or within an extended family where you're around people, or, and this is the thing that really scares me to death, is people getting together for Sunday dinner and all the cousins coming in and the grandmas and stuff like that. So that's some of the stuff that's very frightening. Not only are we having people getting together who aren't together every day, but also we're looking at vulnerable people who might get exposed. So families are there, and then sort of social gatherings are something that we're seeing more and more of that concern us, whether it's, and sometimes it's not descript, because if you're at a funeral, it's pretty easy to know who was there. You can look at the book and you can understand. But if it's a block party or a barbecue, people are doing block parties. People are doing barbecues. And it's those sort of scenarios that are very difficult because there's not an easy tracing you can do of who sneezed on you while you were walking past them. And those are things that really kind of terrify us.
Hunter Dawkins with the Gazebo Gazette has a question. Hunter?
Thank you, Renee. Thank you, Governor. A question for you or Dr. Dobbs, whoever wants to come to the term with this question. Based on the recent health department scenario that was released this morning, where there was another child death from one of the MISC scenario, and what we have heard from you, Governor, that it's almost an absolute that this will return in the fall. Where are we looking for school scenarios to introducing the fall semester back in if we know that this is going to return?
Well, we are in continuous conversations with respect to schools and school reopenings. Obviously, the option of just not having school until a year or two from now is not a good option. And so we're looking at how we can reopen schools in a safe way, at least as safe as possible. And that's something that we are hopeful that we can get those reopened. We think we can do it, but we do understand that there are going to be inherent risk not only in the fall but in the summer. I mean, I think we're going to continue to see new cases throughout the summer. We hope that it stays in that same range that we've been in, because in the range that we've been in for the last 45 to 60 days, it has not put immense stress on our healthcare system. It's certainly not easy, but that's certainly something that we're looking at.
I would like to clarify something. It was a flu death. There was a second pediatric flu death. It wasn't the COVID inflammatory syndrome. So it was a second flu death, and so still, remember the flu shot in the flu season. It's so very important.
Greg with WTJ has another question. Greg? Greg? Kobe with MPB has another question. There we go. Kobe?
Thank you. So when it comes to mental health, I was wondering how much did Mississippi receive from the CARES Act to support mental health, and what plans are in works to address the raising mental health issues because that are caused by the virus and the shutdown?
I don't know the answer to your first question. I'm sorry, but that is not a number that I know for sure. The department does not report to me, and I have not personally been briefed on exactly how much money they have been provided, if any, through the CARES Act. I will tell you that we have spent a lot of time working with them and others, focusing on mental health issues. We know for a fact that many of those issues are real in our communities, but everything from the massive number of job layoffs to asking people to shelter in their home, they all have a cumulative effect and have an impact. And we're looking right now and working on developing some long-term plans to try to address that. So.
And I don't have a dollar value either, although certainly it's a part of our emergency response, and we've had call center and for mental health and referral and all of that, but active part of the response, and there'll be more coming. I'm certain.
Craig with WTBA, this question. Craig?
Yes, thank you. Probably the question we get asked most from viewers is, you're working in a factory or you're in the workplace and the coronavirus turns up or multiple people test positive. What is your advice to those people if they find themselves in that situation? What, if anything, should they do?
So there are guidelines for workplaces, and so certainly if someone, well, obviously if someone's infected, they need to stay home, right? And then as part of that, if you're a close contact, if you've been around someone within 6 feet unprotected for 10 minutes or more, you'd be considered a close contact and should be placed on quarantine orders. And that's something that the health department would work to try to identify and have those folks stay home. But in general, there are safer ways to work and prevent transmission. OSHA has come out with some new recommendations. I haven't had a chance to sit down and read them in detail, but these are things that all work sites need to review to make sure that we can safely have people in the workplace and not have risk of transmission.
Nick from Jackson Free Press has another question.
Hi, yes, just following up on Erica Hensley's question. You said the businesses are drawing.
Nick, I believe we have lost you. It must be from your end because it's it looks straight. Yes, sir.
I probably can finish this question. You talked about businesses are probably causing transmission, but what kind of businesses and what kind of encounters as far as businesses are concerned?
We've seen a lot of different businesses, You know, a lot of times it's going to be, but it's pretty simple to people in close proximity, right? You know, remarkably, healthcare has done quite well, and they're where the COVID patients are because of the rules and the PPE and all that kind of stuff, and an awareness of the risk. But it's really been any business type. Obviously, we've talked about poultry industry and meat processing. That's something around the country, and it's not necessarily in the plant itself, although certainly a component of it certainly almost is. But any business where people in close proximity manufacturing or other businesses we've identified. So it doesn't. No one's protected depending on your business. It's just proximity and breathing on one another is the main thing.
How many outbreaks, not outbreaks, but cases related to like just retail stores, the Kroger or Lowe's or?
You know, we haven't really seen much of that, honestly. You know, I'm not saying there hasn't been transmission of people transiently walking past anywhere, but we haven't had any large outbreaks or really any distinct outbreaks related to like a grocery store or a big box store.
Let's pray that continues because it's really amazing.
Governor, maybe Director Michelle should give us an update on the weather.
Well, as Nick can attest, he just got knocked off the line with a lightning strike. So we're going to have a wet week this week, off and on intermittent rain, but fortunately nothing threatening out in the Gulf just yet. So we're just watching it.
Does not look like it's going to be pretty for the next few hours here in central Mississippi. If the fact that it looks like it's literally 9 o'clock at night outside the window here at this downtown office building. Seeing no other questions, I want to thank all of you for what you're doing, relaying this information to the people of our state. It's critically important that we all work to make sure that as many Mississippians as possible are informed, and your work certainly helps contribute to that. And so I want to thank all of you for that. So to all of my fellow Mississippians, thank you and God bless.